I went to work every day and left on my lunch break and did radiation and went back to work.
I ended up working 3 days after my daughter was born. There's nothing we can really do.
I might not have a job to come back to.
I found myself sitting in a cubicle at work while my son is in the hospital really fighting for his life, and that's a decision no parent should have to make.
This society is built and geared up to just break down the family, and to just split it up.
Paid leave is part of the economic and social fabric of the entire industrialized world, except the United States of America.
People know that the Western European countries are doing better on these policies than we are, but countries like Estonia, Lithuania, Bulgaria,
Vietnam has a generous paid leave policy. China has paid leave.
We and only one other country are the only ones that don't have any paid leave.
It's Papua New Guinea, and the United States in a league of their own.
We are a great nation, and we do a lot of things very well. But in terms of paid family and medical leave, we are far, far, far behind.
Why is it that the rest of the world has figured this out and we haven't?
We are a great and mighty country. The U.S. boasts the world's largest economy and the most powerful military. But of the 39 industrialized countries, we rank 34th in life expectancy, 28th in gender equality, and dead last in maternal health, child health, and family-friendly policies. When it comes to happiness, we rank 19th. Hundreds of experts think paid leave is the missing piece. Paid family and medical leave differs from paid sick days, which we use for routine illnesses that require only a few days for recovery. Paid family leave covers a longer amount of time, usually weeks, to tend to a new child, serious illness, or aging family member. Small businesses overwhelmingly support it. 83% of Democrats support it.
Paid family leave. This is something that must happen.
71% of Republicans support it.
You are from a right-leaning think tank, and you like this as well.
We believe that the U.S. needs a paid family leave policy at the federal level.
It's proven everyone can use paid family leave.
Every worker in this country will have a life event, an ill family member, a sick spouse, a dying parent, or a new child.
Paid leave is important, first of all, if you have your own illness. What if you discover you have some serious chronic disease?
Uniform pants, your homework pants?
No.
No, what you gonna wear?
Some dresses.
A dress? But it's gonna be cold tomorrow. Go to college? Because I say so. Watch me learn, watch me grow.
Breast cancer is very painful.
When I first met with my oncologist, his recommendation was for me to go on disability throughout my whole treatment. Realistically, that's not something I could do. Disability will only pay me $1,600 a month. My rent is $1,100, electric, gas, all the necessities. I don't get no assistance from the government or anywhere. That worry of me choosing between work, kids, roof, food, that's an everyday struggle. I would get chemo that Thursday, go back and get the shot that Friday, and I had Saturday and Sunday to heal. So most of the time, I was back at work that Monday.
Huh? I'm a superstar every day. Don't you know that?
I'm still not healed from my surgery last year.
So she's gone through several infections. Several times she's had to be re-hospitalized. But then when she goes in the hospital, that's when she gets her rest.
If the employers would have just went on and gave me these 2 months off, I would be on a different level while I'm at work. Instead of me being at work and just in constant pain and struggling to get my work done.
One of the most difficult things for a physician is to realize that what's in the best interest of their patients are not doable. I know what's associated with the best outcomes, but I know that the patients can't do it because they've got to decide, do I want to do what my doctor says, or do I want to be employed and have money so I can buy the food that my child is going to need. Which of these competing needs takes precedence when all of them should be met?
My doctor was just like, nobody told you to go back to work so soon. Your body went through so much, just giving birth to like a whole human being. You shouldn't just go back to work.
I think 12 weeks paid leave for mothers is a floor. It takes 6 weeks just to get your physical being back to its normal place.
The other issue paid family leave impacts is breastfeeding.
Breastfeeding is one of the best things you can do for a child's immune system. You're more likely to breastfeed for a longer period of time, clearly, if you have more time off. That's been shown in study after study.
I have no idea what I'm going to do with little girls. You can think you're going to raise a little princess and she turns into a tomboy, or you think I'm going to make her a tomboy. You end up with a closet filled with little princess dresses.
I'm just really excited. I've always known I was meant to be a mom.
Today we just had our 18-week scan of the babies, and they are healthy and beautiful and growing perfectly, and I'm very, very happy.
My company's just really great. They do pay for 1 month paid maternity leave.
I'll be able to take some time off, but I think it would be frowned upon.
You just don't expect to go into labor, obviously, 6 months in.
From the moment her water broke, the girls were both born within 15 minutes. They were born about 2-3 minutes apart. Riley lived for 45 minutes to an hour. Ashlyn lived for 4.5 hours.
I remember when we knew we were gonna lose them. Nurses kept saying, do you have a hat or a blanket that you'd like them to wear? And I kept saying no, because I thought I had 3 months of pregnancy left. So I felt, I don't know why, I think that's just a mom thing. I just felt really bad that I didn't have any, have anything for them. But they have this volunteer group, I think, at the hospital that crochets them and stuff for situations like this.
The doctor was looking at her and he's like, you can't leave her alone. She needs someone to be with her all the time. I reached out to HR and she said, well, you know, it's 3 days for death of an immediate family member, but technically you get 6 days because there were 2 deaths.
I think of 6 days, and I just wanted to be like, okay, do you want me to tell you what the first 6 days was like for us? Day 1, you're holding your children while they die. Day 2, you wake up, relive the nightmare all over again. You go home to package slips that you have a delivery, and it's 2 car seats from his aunt and uncle from our registry. Day 3, you have to find some way to memorialize them, and you realize you don't want to do a funeral and there's no time. So, we had a little memorial, threw pink tulips into the lake and wrote letters to them. Day 4, you have to get all the paperwork done. You have to go to the funeral home.
Picking up their...
Picking out an urn. Day 5, his family left. Day 6, my family left. So those were our 6 days.
We're getting people to sign postcards to their senators saying, yes, I want people to be able to be good parents and good children without going broke.
All they have to do to sign?
That's right.
Ellen Bravo has been advocating for paid leave since the early 80s.
Let's go back to the single mother with the 2 kids. She's the one who's working at the brewery because she needs to make a decent living. Companies are prospering because they treat people with respect.
I don't know if you realize what you're saying. What you're saying
I always realize what I'm saying.
Well, all right.
Our movement is building broad and diverse coalitions. Every one of our coalitions has small business owners as partners. And that's because they really want this for their staff, but can't afford to do it on their own. They understand the need for this policy.
We've surveyed employers in California who've had paid leave for 10 years. Overwhelmingly, 90% of businesses said no negative impact on their bottom line or a positive impact. And they say in terms of morale and retention and goodwill, 99% support it.
Small businesses are the backbone of the American economy. In fact, more than half of the U.S. workforce is employed by a small business. And despite the myth that paid leave hurts small businesses, many of them are offering some paid leave on their own, even though it's not required by law in their state.
In these times offers 13 weeks of fully paid maternity and paternity leave.
Part of the reason for doing that was to maintain and keep employees.
I think Rachel might have left if we had not had good maternity leave. She's really valuable to us because she just gets the magazine out every month. She's also our longest time employee, so she has this incredible institutional memory. Certainly Rachel could double her salary, possibly more than that with her experience.
If they had no maternity policy, I probably definitely left.
Hi, how you doing? Here's my news.
Our employee Mari had a baby a couple months ago, and she has been with us since the day we opened.
Josh and Christine told me you're going to have 3 months leave and you're going to have paid maternity leave. So when they said that, I had like a huge amount of just stress just fall off me. I think about my future, but I don't see myself at another job. I see myself growing more with Honey Butter Fried Chicken.
I think that these are like long-run expenses. Health insurance and paid time off certainly cost us money, but we built it into the structure of our business because it's not a viable business if you can't take care of the people that are working for you.
If DC approves a new paid leave proposal, it would be one of, if not the most employee-friendly plans in the country.
Today is the third hearing they've had, and this one is focusing on the people who live in the district.
My name is Roger Horwitz, and I own Pleasant Pops. We're a DC small business. As a responsible employer, I'd love to be able to offer paid leave to my employees. At Pleasant Pops, we offer living wage and paid sick leave. We provide health care, even though we aren't required to do so. And these choices have paid off. Our business has been very successful because we invest in our great employees. But there's one piece missing. We can't provide paid leave because we don't have the cash on hand to cover 16 weeks of leave. We're behind you 100%, and we'll continue to fight for this benefit as small business owners, as DC residents, and as future parents.
Paid family leave becoming law in DC. DC Council voted 9-4 to give more than 500,000 DC employees up to 8 weeks of leave.
There are 9 yeses and 4 noes.
The measure passes.
I want to study to be a radiologist. This is my dad and I, he had long hair. July 4th, my dad was not feeling good. He had leukemia. He was working at a company as a forklift driver. His job told him, obviously, since you're sick, you can't work with us, so he was fired. My mom, at that time, she was working with him, and they fired her because they didn't want her to make excuses to miss a work day or something. July 31st, my dad passed away. I started missing a lot of days at school. I stopped going there my junior year. I was devastated. I was like, what am I going to do? If my mom had her job, it would be easier, I'd be going to school, not worrying about anything,
Sometimes it's hard to explain to people why paid family medical leave has such a high return on investment and is so important. And I've started to have a visual picture of why.
The sticky floor. It's one of the reasons why 2/3 of minimum wage earners are women, because too many of them get stuck on the sticky floor of not being able to earn enough seniority to increase their pay. Because every time a life event happens, they start over again on the bottom rung.
We shouldn't leave all this talent on the sidelines. It hurts our global competitiveness to do so. In the year 2000, female labor force participation in Canada and the United States was identical. Fast forward to today, Canada is something like 7.5 percentage points ahead on female labor force participation. Why? Because they put in place increasingly progressive paid leave policies. If we had simply kept pace with Canada, over this period, we'd have 5.5 million more women in the workplace. 5.5 million more women contributing to our innovation economy, adding literally over $500 billion to our GDP.
There's another group of working people who actually need paid family leave support. The millions of Americans who provide care for their aging parents or spouses. We are in the midst of an unprecedented elder boom. Every 8 seconds, another baby boomer turns 65 in this country. By the year 2025, 1 in 5 Americans will be over the age of 65. We're rapidly aging, and at the same time, we have less people that are available to be able to care for people, especially aging adults over the age of 80, when they need more supports and services.
The reality is that we don't have enough health professionals to care for our aging population. So we will need to rely on family members and caregivers to resolve this growing need. If caregiving support is not available, seniors are likely to be placed in a nursing home or in an assisted living facility where the cost triples, if not more, to care for that person.
The national average cost of a semi-private nursing home is about $82,000 a year. What family in this day and age can afford $82,000 a year?
It's very important to stay in my own home because I have independence. It keeps me much happier, and it keeps me more that I can do some things for myself.
This is your vitamin B12. You take one of these a day? Okay. It was a struggle trying to go to work plus take care of my mom. Paid leave would have helped me out a tremendous amount.
Fundamentally, the challenge that we're facing is that too many families are having to make options between continuing to work or to caregive. And there's not a family that can afford to not work, and there's not enough caregiving options that are really affordable and accessible for most families.
Okay, have a seat. Wonderful, wonderful.
This is the state capitol in Madison, Wisconsin, and we're here for a hearing before the Senate on the Wisconsin Family Insurance Act, which would create a family medical leave insurance fund. So whenever we work with, the women we work with, and they're thinking, oh my God, I can't get up and speak, and I'll tell them, we get to tell them what you have is misinformation and lies, and what we have are the facts, and also the power of people's painful experiences that's going to change the world.
I didn't know if I was going to be able to make it through this conversation without tears coming, and I'm trying to fight them back now because my mom passed away. She suffered from many strokes before the massive heart attack took her. I'm here telling you that I wouldn't understand why I needed to choose, right? I didn't understand why I needed to be able to say either I go to work today or miss the very last chance to be able to see my mother on this side of glory. One thing that we all have common in this very same room right now, there's two sure things. One day we're going to be born and one day we're going to leave. Some people have the luxury of the high-paying jobs where they have the security of being able to say, well, we have this nest egg saved up so we don't have to worry. But what about those that don't? So I took a deep breath today and I told my mother, this is for you today. I'm sitting here on behalf of anyone else that's actually facing this right now today, whether or not they need to go to work or be able to sit by their husband's bedside, their child's bedside, significant other's bedside, without having the luxury of being able to say whether or not we're going to pay the bills or not. So take that into consideration when you're talking about passing this bill or not passing it, because it does affect so many lives, not just mine, but the others to follow. Thank you.
Thank you. That concludes the hearing on your bill.
We just saw something extraordinary today. There were people here, lobbyists, to indicate their opposition to the bill, but they did not stay to speak. Because what would they have said? What would they have said to Nancy Yarborough about her mother? What would they have said to Tamika Vukovic about losing her baby? What would they have said to Ronnie Crosby about being told by his employer, you didn't have that baby so you don't get to take care of it when it's sick? They couldn't have answered that. That's the consequences on workers and their families when there isn't affordable leave. Bills for paid leave have been introduced in nearly 24 states. That's clearly paving the way for a national bill so that everybody will be covered. The momentum is going to carry all over the country. We're going to see a growing movement.
There are problems almost impossible to comprehend fixing within our lifetime. Global terror, climate change, the growing island of garbage the size of India in the Pacific Ocean. But paid leave is something we can change now.
It's not a question of if, it's a question of when.